Achilles tendonitis can be a very debilitating condition. So that's when there's a lot of strain on the Achilles tendon, and the response by the surrounding tissue, or the sleeve that the Achilles tendon lives in, produces a lot of fluid because of the irritation to the tendon. So the sleeve is producing fluid to protect the tendon, but in doing so it increases the pressure in the sleeve and pain. And that increased pressure can also cause damage or injury to the Achilles itself. Like plantar fasciitis, Achilles tendonitis also has a very close relationship with the tension being generated by the calf muscles. That's to say that if your calf is tight, then every step you take, you're increasing the tension on the Achilles tendon. So Achilles tendonitis is painful with activity. It's painful when you first get up out of bed with your first few steps. It's painful when you get up from a seated position.
The treatment is initially really focused on trying to take a little bit of the tension off of the Achilles tendon. So I usually start with simple things like using a heel lift in your shoe and maybe even a walking boot if it's really sore. And then once the pain has decreased sometimes, then we'll start some physical therapy for some stretching. But I do find that sometimes a lot or too much stretching while it's really sore can actually aggravate the problem a little bit. But ultimately that's what's needed, is to gradually stretch the Achilles tendon out. There are sometimes some injection type procedures that can be useful for Achilles tendon problems, and those are often done under ultrasound guidance. There is sometimes a role for surgical intervention for Achilles problems, but really only after a very long period of conservative treatment, again, because a lot of these will resolve with appropriate treatment, and the surgery is not without its own problems. It's a lengthy recovery, and obviously there's always some risk involved with that. So generally we start with non-operative treatment and then only progress to surgery if things really aren't improving.